aspect of our webinar. I invite Dr. Suketu Bhapal to share his screen. As he is sharing the screen, let me introduce him. He is our dynamic young secretary of Rajkot Ophthalmic Society. He is a proficient phaco and refractive surgeon. He is doing great work as secretary of our society, always ready to help with a smile. Whenever you ask him to do any work, he just says it will be done. That's all. So, great team person to have. And I invite Dr. Suketu to give his experience of the last 2 weeks, last 2 or 3 weeks that he has gone through.
Thank you, sir. Am I audible?
Yeah.
Am I audible
Yeah,
now?
you're
And
audible.
the screen is, sir,
Yeah, but
you
not
can see the full screen?
not yet.
Not full screen?
Uh, I cannot see you. Your video is on, right?
Okay. Video is off, sir, yes.
Yeah. Now you're on. You're coming on.
Yes, sir. Good afternoon, one and all. Again, you all must have seen, read all the articles about COVID and all. I will be just sharing my experience, how I feel, how Corona comes to my home. Uh, how infectious it is. We used to see about COVID in China in news 6 months back. Not taking seriously, at least me. Most of us were planning conferences, get-togethers, trips for summer, and in 6 months I got a COVID positive case in my home. This shows how infectious it is and how it came to my home. My wife, Dr. Megha, in COVID duty since March, and she had suspected first case of COVID in Rajkot, which came out to be the first positive case of Rajkot. She hydroxychloroquine prophylaxis 200 milligram weekly. Since then, in first line corona warrior, she was posted at Ahmedabad. On completion of 10th day, she has started symptom of malaise and headache. Still, I felt it cannot be corona, maybe a mild flu. Maybe I am a positive thinker, that's why. Same day, when we went for an CT chest and found to have a suspicious lung patch of right side. This is the thing we got in first CT. We tested for COVID on the same day and it turned out to be positive, along with a colleague who went with her, and both got tested positive with different clinical presentation. Her colleague would have symptoms, while Meghavi has some mild malaise and more of a GIT, gastric upset. She both admitted in hospital special isolation ward since then. She had a mild diarrhea, malaise, headache, and low-grade fever, not much of a symptom at admission. All the routine investigations, CBC, RFT, LFT, PTA, D-dimer, ferritin, CRP, procalcitonin, IL-6 level, electrolytes, all were done slightly on higher side. Of course, all are in normal range. Standard treatment of hydroxychloroquine tablets and azithromycin tablets, vitamin C, zinc tablets, and lots of fluids. IV ceftriaxone 2 gram IV was given as she had some lung patches at that time. SpO2 was throughout normal. On fifth day, both had respiratory palpitations and mild chest pain with dry cough. Repeat HRCT was done and both lungs was filled with ground glass opacity along with normal SpO2 and no breathing issues. These are the pictures of the repeat fifth day CT scan. According to this, both lung has a ground glass opacity and disease has worsened, improved. After that, BD was started and has a dramatic response. Diarrhea gone, malaise gone, crepitations gone, no chest pain and cough. Follow-up CT scan shows resolving lung patches. We have some ups and downs during her course of disease. After this MPS, we found that everything is placing in place and she is recovering well. We were very happy. And after 2 days, her pulse was 30, along with perspiration and throbbing headache. Done on the same night. ECG shows QT prolongation, echo shows pericardial effusion, and continuous SpO2 blood pressure monitored. Cardiac marker absolutely normal. So the possibility of viral myocarditis or pericarditis were ruled out, according to cardiologists. After all this investigation, cardiologists came to a conclusion that there was no cardiac abnormality and it is due to an overvagal tone and a suppressed sympathetic tone that is again due to virus. So this shows that this virus can affect gastrointestinal system, respiratory system, cardiac system, autonomic system, and many more, I guess. Felt during this course. We people are staying with her for 2 hours. The worst, the worst thing of this disease, as Madam has already mentioned, you can not see, just talk on phone for a few minutes and keep on thinking whole day that what you are handling calls from friends and relatives. Of course, they are concerned, but you are handling too much phone calls. You are managing online studies of your kids. You are sleepless. You are anxious. You become more suspicious. A single sneeze or cough of kid make you think of corona. And what is really helpful in this tough time of quarantine, your support of your family and friends, your faith in God, and just you need to time pass with some positive mindset that you will come out of this illness positively. So what I feel is younger patient high viral load can have severe effects due to, I still believe, if instead of going for 10 days at a study, if Meghavi has broken duty at 5 days, it has various systems. HRC has a role in early diagnosis. Also, is a very handy tool to have in home. You have some fever and all, you can continuously monitor your pulse along with oximeter as idea was very, but it is mentioned there do have significant role in decreasing inflammation. HCQ, I think, is a or in three. With positive mindset, family and friend support, and faith in God, you can come out of this highly infectious and understudied virus infection. Thank you. That's all from my side.
Thank you, Dr. Suketu, for that excellent, all-encompassing review of what you went through. I was very surprised to see that there was bradycardia, which was very worrying, I suppose, for uh, all of us. And how easy or difficult is it to get the day-to-day updates from the treating medical personnel? If I can ask you, Dr. Suketu. Hello. I think we have lost connection with Dr. Suketu. Can you hear us, Dr. Suketu? Yeah. So he has just sent me a message that it has got frozen from his end, and I apologize to one and all for having major issues with this platform, Microsoft Teams. They told me that it is going to be better, but probably it is not so. But we did have a good webinar with accounts from all the participants, and including tips about the lab tests and the HRCT. And I cannot but thank people enough, all those who have participated, the doctors, Dr. Kulkarni, Dr. Priya Naran, Dr. Jagdish Rana, Dr. Suketu Bhapal, to come out with their own personal experiences at this tough time. This shows their commitment to teach and learn from these diseases, because this can be anyone, me or you or anybody who's watching. We never know. Only yesterday we had 20,000 plus cases for the first time, and it is going to go higher. The peak is not yet in sight, and the doctors are in the firing line. So we are very thankful, grateful for everybody to participate in this webinar, and I hope we have learned something out of it. And if you have any closing